Okay, for some reason the video is cutting off too early. I've recorded the whole chapter and it's not recording but only 6 minutes, so I apologize. But here's hopefully part 2 of it. Picking back up with education on sickle cell on page 826. Make sure you inform the parents of the side effects, gastric upset, nausea, vomiting, constipation, and black tarry stools. Very, very important. Alright, let's talk about sickle cell. This is the most common genetic hematological disease condition in children. Make sure you read through the patho behind it. Keeping the child very well oxygenated is very important because that can cause pain in itself. This is all winks and lollipops. You need to know that the RBCs, the sickled RBCs, are hemolyzed 8 to 21 days, so a lot shorter than normal RBCs. Okay, increased hemolysis causes, because of their chronic anemia, causes infarcts in tissue. Okay, ischemia, tissue death. So if you have a child that's playing sports and starts complaining of chest pain, you need to take them straight to the ER. Okay, it's very important because this can cause infarcts in that tissue, in that heart. Okay, this puts a lot of strain, the hemolysis of the sickled RBCs, on the spleen. So these children are considered asplenic. Okay, without a spleen. They become very weak, fatigued, they have tissue hypoxia, and they can have that acute chest syndrome. Okay, so make sure you know this, winks and lollipops. Okay, let's look on page 828. This is at the top of 828. So if you have a carrier, the mom's a carrier, the dad's a carrier, they can have a child with sickle cell disease. Okay, they can have carrier children, they can have a non-carrier child, but they can have one with the sickle cell. I have a friend in Macon that has 4 children, and she and her husband are carriers. They didn't know it at the time they got married, and they had a child that has sickle cell. He was getting, when I lived up there, he was getting blood transfusions every 2 weeks. So it's a horrific disease. Big thing with these sickle cell kids are rest periods. Okay, make sure that they are resting. Make sure they're staying hydrated. Wink and lollipop here. And I don't know if I said it if it cut off before I said this, but the sickle cell is named after a sickle, like the Grim Reaper has a sickle. And it's just a tool that was used to cut down wheat back a long time ago. But that's where it gets its name from. Okay, so it's already anemic, and then they're sickled shape. They break down a lot quicker, like I said, so it kind of kills their spleen. The drug of choice for sickle cell patients is morphine for pain when they're in crisis. So of course we're monitoring the respiratory rate frequently. Okay, always have Narcan with anybody that's on a PCA or getting any type of narcotic. You're going to have that Narcan available. Okay. Another thing on page 830, an education and discharge. You're going to make sure that they are up to date on all their immunizations. We do not need a sickle cell child to have communicable diseases like chicken pox or anything. Make sure they stay well, because they don't have the spleen, to fight back. So make sure that you're keeping those kids immunized. Hemophilia on page 831. So it's the most common of hereditary bleeding disorders. It's the absence of factor 8 and 9, hemophilia A and B. and the plasma proteins that are required. So those plasma proteins are just not there. Signs and symptoms. Winks and lollipops, you need to know these too. Bruising, bleeding, even like losing a tooth can be excessive amounts of blood. Painful joints. You're applying ice everywhere that they're bleeding, okay? Anytime that they're bleeding, nosebleeds even, put lean them forward, put a pack of ice pack on their forehead. It's not preventable, but we can educate our parents to avoid aspirin. So you remember when we were talking about the raised disease, the list of medications in your book, like Pepto-Bismol was one of them. Make sure that they are not giving their kid any type of medication with aspirin in it, okay? Make sure they know safety precautions, wearing helmets, not riding a skateboard, anything that's high risk should be avoided. Sleeping on the top bunk bed, even. So we need to make sure we are educating our families. All right, let's talk about von Willebrand disease. This is a common inherited disorder as well, and it plays a role in the early phase of hemostasis, enhances platelet aggregation adhesion, it acts as a platelet plug. Okay, it's autosomal dominant, and affects males and females the same. It is manifested usually by nosebleeds is a big one, menorrhagia is a big one, so just make sure you read through this. But just know that the disease, nosebleeds, is a huge factor in von Willebrand's. You can't stop that nosebleed, and that's called epitaxis. And so in my book I have written, tilt the head forward and hold pressure on the nose for at least 10 minutes, okay? Even the smallest nosebleed can be traumatic for families, okay? And to prevent, hopefully, nosebleeds as much, you need to educate your families to use a cool mist humidifier, okay? Soft, bristle toothbrushes, gentle flossing is encouraged. Then on page 835, it's a case study. Make sure you read through that case study. Let's talk about neutropenia. There's a nosebleed. Neutropenia starts on page 838. So it occurs when the absolute neutrophil is less than 1,000 in kids younger than 1 and less than 1,500 in anybody else, okay? Know your signs and symptoms here: fever, lymphadenopathy, organomegaly, pallor, bruising, and petechiae. They usually will not have classic signs. They have subtle signs, so you need to know your patients, okay? You need to keep them away from any type of fresh flowers, plants, produce, raw honey. These are important. Make sure that they're not eating, because a lot of these have pesticides and bacteria on those fresh fruits and vegetables. So they need to stay away from those. Alright, and this is just that same list. Let's talk about blood transfusions. This is your list of different blood products here. Of course, RBCs, platelets, FFPs, and then you have your factors here to treat those hemophilic patients. Typing and cross-matching, is the key, right? Alright, then there's focus on safety. This is important. You need to know this page, on page 842, okay? Pre-transfusion, what we're doing, verifying everything. How many nurses does it take to do a blood transfusion? 2, always 2, at least 2. And we're getting vital signs. Staying at bedside for at least the first 15 minutes. I stay at least 30, because minute 16 can be traumatic. So, and you don't want to walk out right when something's happening. But winks and lollipops, okay? You never, ever, ever run blood through the same IV with other solutions. Only exception is NS, normal saline. Not D5, not LR, only NS, okay? Never add medications to the blood. Make sure you're getting vital signs. Make sure you know the signs and symptoms, what to look for. Tachypnea, feeling doom, chills, back pain, I have written in the side. So write chills and back pain here, okay? If you see any of this, what are you going to do? You're stopping the transfusion, okay? It's important to know their temperature, because if they become febrile, that's a sign that something's going wrong, okay? Pre-dose them with Tylenol and Benadryl, and that's usually a standing order in the hospital. So, but if you see any of the signs and symptoms, you're going to stop the transfusion and notify the provider immediately. All right, that's it for Chapter 24. I hope it records it.